Welcome to Development Desk, a space where parenting meets psychology, advocacy meets action, and insight replaces the noise. I'm Anna, a school psychologist and mom, sharing what I've learned from years inside the system and alongside families. Together, we'll unpack the why behind the behavior, decode the school processes, and build something strong, one conversation at a time. From insight to action, from chaos to clarity, this is Development Desk. The information shared on Development Desk is for educational and informational purposes only. While I am a licensed school psychologist, this podcast does not constitute psychological services, legal advice, or therapeutic relationship. The views expressed are my own and do not reflect the policies or positions of any school district or employer. This content is not a substitute for professional consultation with a qualified provider in your state. Always seek appropriate support when making decisions related to your child's education, health, or legal rights.
Yeah, and then
Yeah.
as soon as you cancel it, the next day it's back, or, a month from now, or again, your kids have to go, to the doctor or something. And so again, don't let perimenopause gaslight you into thinking that you're crazy.
Right.
Because again, you're not, but your hormones may be. And so again, you've got to just trust your gut in that, hey, something is not right here. And again, if it's happening super infrequently, the most useful thing to do is log your symptoms, because it can be super hard to identify a pattern just going from day to day. You just probably aren't able to do it or to pick it up. But when you can see it on paper, add in the things too, days that you exercise, things that you ate, days that you slept well, add in all of those things to that log. And then you can start to start to identify patterns. And that makes it a lot easier too for your clinician. If they kind of have all the data there. We need data.
Right.
So again, if the labs aren't helping us, then we need, and the other thing too is that the labs are only a single moment in time.
Yeah, I wanted you to talk about that. I remember you had shared that.
Yes. So labs are only a single moment in time, especially when it comes to hormones. So all of our hormones have natural fluctuations. So cortisol, for example, it's higher in the morning. It's responsible for sleep-wake cycles. A lot of our hormones are going to be their highest in the morning. Testosterone's another one. We like to check it before 10 a.m. so we can see its natural peak. Melatonin's obviously in the evening. And then we just talked about the normal menstrual cycle, progesterone, estrogen, your LH, FSH. Those all fluctuate at different times in your cycle. So it's really important that you know where you are in a cycle when you're evaluating these hormones.
Okay.
And I just mentioned in perimenopause, the hormones can be all over the place. And so you're going to get, when you go to a doctor and say, hey, I want to check my hormones, you're probably going to get a few different responses. So hopefully the first question is, why? What's going on that's making you want to think that? Another response is going to be, no, we don't need to check hormones. They're not going to tell us anything, especially when it comes to menopause. They're going to say, no, if you're still having cycles, everything's fine. We don't need to check anything, which is not entirely true. It's partially true. And then the third thing, which is the truth, is that especially if you're in perimenopause, your hormones can fluctuate. So when we check them and they appear normal, we may have just caught you on a normal cycle or a normal range of the month. And if we check you next month, it may be drastically different. And so that's really important to keep in mind. So on one side of that coin is then the thought that okay, well, then there's no point in checking because we can't really interpret how, what the results are showing. But when we're checking hormones specifically, we're really looking as physicians, we're really looking to see if there's a drastic abnormality, okay? We're looking to diagnose a significant metabolic, problem. We're not looking for could my, thyroid hormone be optimized and, maybe my FSH is just a little high and I can take some magnesium. We're not looking for that. We're looking. Do you have a serious thyroid problem? Is your, are your adrenals not functioning? Do you have a pituitary tumor? We're looking for serious stuff. And so when or PCOS, are we seeing a really high testosterone level? Those are things, if you have a serious issue with your hormones, those are things that are generally not going to be fluctuating. Okay. So that you don't have to worry about that. If you got a brain tumor, it's not coming and going. Okay. It's just secreting hormone all the time. And we're going to catch it. Okay. So don't be afraid. But as far as cycles and all of that, it really depends on where you are in your cycle, and expect there to be some fluctuation. And don't let anybody just write you off of like, oh, they're normal, and they can be. Because remember too, think about PMS. Okay. You feel like crap. There's no denying it. Okay. But your hormones are normal. They're doing what they're normally supposed to do. Normal does not mean you feel fine and everything is rainbows and unicorns and you're just crapping Skittles all day.
Yeah.
Yeah.
That's a good reminder.
Yeah.
Yeah, that's a really great reminder. Lately, so the reason why I went to my physician was because lately I had been feeling something just feels off. Typically, when I work out like this and I eat like this, I'm able to drop the last 5 pounds. You know, I'm able to like feel my best. And more typically, it's just a few days in a month where I don't feel my best. But now it's becoming 5 days, 6 days, 7 days. And even this last week, I couldn't sleep very well. And, you know, I've talked to you about this new birth control pill that I'm on.
Right.
And now that you're saying all of it, it makes sense because I stopped taking the blue pills where my headache started, and that's when I couldn't sleep. And so I'm like, okay, that's the hormone drop. And so I went to my physician, and same thing is, you know, you're okay. And I did have a really great nurse practitioner a few years ago where she did extensive labs on me. Come to find out, it was really my allergies that were bothering me. So I did the immunotherapy shots. And then I needed more vitamin D.
Okay.
And so then I felt I was feeling great after that.
Sure.
But recently, you know, I went to the same office. She wasn't there. Can't find her in San Antonio. I don't know if she went.
I stalked her. She's not here.
Yeah. And I wasn't getting the same care from that person at the same office, but just a different person. And so I'm just at this place trying to figure it out. Like maybe I'm overthinking it, you know, maybe I'm just fine. I'm okay. Like I'm, you know, I'm very regular. So then everything must be fine. Right. So, I'm just kind of in this limbo.
It always kind of stinks too, especially when you're, again, kind of having to be forced to transfer care, right? A lot of offices have policies too. I don't know if that office let you pick who you were going to see next, or they just sort of assigned you. A lot of times too, I remember when we first moved to San Antonio for my daughter, I just picked kind of a random pediatrician. And it was just not a good fit, just personality wise. It just wasn't a good fit. And a lot of offices have policies like once you've seen somebody, they don't just let you pick up and see somebody else. You know, once you're assigned to somebody, that's kind of it. And that's really doing a disservice. Because again, there's no point. Because now you probably feel like, well, there's no point going back to that person because they didn't do anything, or they didn't, you know, really seem to, again, have a good connection. So now you're just not going at all. Now you've got the kind of sigh that comes with like, well, let me just start looking for somebody else. And like, and then I have to make the appointment. You know, you talked about in the intro of like, why are we so good at taking care of everybody else and not ourselves? Well, like, yeah, goodness. And if you're already not sleeping well, you're tired, you have a million things on your plate. The easiest person that you can do off with is you, right? Like, it's only affecting you. So you can just not make that appointment. You don't want to have to take time off work. You don't want to have to go sit in the crowded waiting room, you know, for 4 hours and then all to just kind of not get answers.
Right.
Sounds terrible.
Yeah.
I wouldn't want to do that.
Yeah. In fact, I'm canceling my appointment to follow up on my labs because for all the reasons you said, what am I going to do? I got my labs back and I was just a little low in one area. I'll show that to you after we're done recording. But everything else came out normal. And I'm going to show up and they're going to be like, oh, you're normal. Everything's great. I don't,
I will say, okay, so tiny caveat is we do need feedback from our patient. We do need information because I find that this happens a lot, that we will have an initial visit about some issue. We'll kind of do our initial, what we think treatment or eval. And then if it doesn't work or something changes or whatever, patients are like, well, that's what she said to do and it didn't work. So I'm just not going to go back. But you coming back to tell us that didn't work is useful information. We may not hit it on the head right from the get-go. So just knowing that like, oh, we thought it was this, but we tried the treatment for that and it didn't work. That will that out. Or maybe we need to
Right.
tweak a dose of something, or maybe, again, maybe there was something else kind of second line that we were thinking of, and maybe we need to go that route. So it is really important to give feedback to your physician, because again, they can kind of, again, continue to go. So in your case, what I would say the ideal situation would be just a quick phone call to follow up those labs to say, hey, I got my lab results. I noticed that I was just slow in this. Everything else looked normal to me. Given our last conversation, is there anything further that you would recommend? And if they give you the nope, everything seems fine, then at least you've only wasted, 10 minutes on a phone call, and you kind of know that okay, that really was the end of the line. And just to, again, kind of confirm that there wasn't something else that they were like, well, after our visit, I kind of thought about this, or I had a note here to consider this. You kind of never know. We really do think about our patients a lot when you're not in the office. And so sometimes we've, thought about something after the fact or made a note about it. And maybe it just didn't fit into that 15 minutes. So just food for thought. But I certainly wouldn't be wasting 4 hours of my day to be going up there to say
yeah, that's definitely something I can try. I think that also this one nurse practitioner, and that's the other thing, when they see my file, you don't need to see a doctor. Are you okay with the nurse practitioner?
Right.
Because I'm a healthy person, right?
No.
And then, so the other thing she did was, as you know, I'm going to Africa. And so I had asked her a bunch of questions to prepare for the trip. And she literally went to the other room, printed out Google things about the area I'm going to, and gave me those. I'm like, okay, well, I could have found out this information on chat. Thank you.
Yeah.
So it was just very unpersonalized.
Sure.
But I think I will do what you said. And I think it, like you said, it's just going to be 10 minutes of my time. I can at least call back, and maybe she thought about me, but it just makes me feel like maybe not.
At least you can confirm, and you'll be good to just be like, bye, Felicia. See you. See you not.
That's no, right?
Yeah.
Are there any most overlooked screenings that women don't think about when they're feeling off or not normal and they're going in? Is there something that they can maybe request for or think of?
Yeah.
They don't know, or that's
so some of them we've already mentioned, and it really depends on what your provider does as kind of their basic wellness. But usually this is going to include your blood count. So this is important, especially for fatigue. We want to make sure you don't have anemia. Your blood counts are also a screening test for cancer. So things like lymphoma, leukemia are going to show up here. Infection markers are going to show up there. So that's really important. Most providers are going to check your liver and kidneys and your electrolytes and your sodium and potassium and all of that sort of stuff. They're probably going to check for diabetes. So that's a really important one we don't want to miss. And, we don't really I don't think most people think of diabetes as a hormone issue, but insulin is a hormone. And so diabetes can definitely be making you feel super sluggish, gaining weight, feeling like you're hungry all the time or thirsty all the time. And so that's really important. We don't want to miss that. Checking things like cholesterol. Again, that's not really going to have symptoms, but that's going to be, later on down the line, cardiovascular disease. One that you mentioned that was low was your vitamin D level.
Yeah.
So vitamins can be important. The usual ones that I check in my patients are going to be vitamin D, which I would say 80% of my patients are deficient. Also, especially people
80%?
Yeah, most people are deficient. Especially albino people like me who have never seen the sun and burn at the sight of a window. I would probably say 80% are pretty deficient unless someone's taking supplements. Again, you're a very healthy person. You're not just eating Doritos all day. And you are deficient.
Right.
I'm generally deficient at baseline. Again, even during nursing, I'm taking 3 times the amount of vitamin D that I needed to so that my babies could get vitamin D too. And even then, when I checked my lab, normal is 30 to 100. Even taking 3 times the recommended amount, I was like 31.
Oh my goodness.
So it's very common for it to be deficient. Folic acid or folate, and then B12 are 2 other ones that are commonly deficient, but they're also one of the most commonly supplemented. So people love to take a B12 supplement. The PR campaign for B12 has just done a great job. People think B12 is the fountain of youth. So a lot of times I want to check it to see if what they're taking, if it's actually maintaining their levels. Because if you're taking a supplement and I can't even detect it in the blood, You're just wasting money.
Oh, that's so true.
And then a lot of times too, so B12 will often be high, little tidbit, if you're on a GLP-1 like Ozempic or Wegovy, or if you're on a compounded one, a lot of times they're compounded with B12. So again, your B12 may be high. This isn't dangerous, but you definitely don't need to supplement. So 3 vitamin levels I'll often check. There is actually not a standard recommendation to check your thyroid hormones unless you are symptomatic.
Oh my God. So I'm so glad you pointed that out.
Yeah.
So my mom has hypothyroidism.
Okay.
And I specifically asked them, check my thyroid levels. I want that in my lab.
Yes.
Of course, the doctor forgot. I showed up that morning. No, we're not pulling for your, okay, well, you're not getting my blood until I have it in writing that you are taking my thyroid.
Yeah.
Because they aren't checking for it.
Yeah. So there's no standard recommendation. However, I check it in all my patients because the number of patients that I have caught just doing a routine screening, because, okay, so spoiler alert. So number one, you had a family history. So that's a very valid reason to check thyroid, because thyroid disease definitely has a genetic component. So it's very common, especially in females on, a family history to travel down that lineage. So number one, that should have been reason enough to check yours. Number two, if we think about the symptoms of thyroid disease, okay, the symptom one is fatigue. Find a human being in this country who is not tired. Just use that. Just use that as our diagnosis. So that is in and of itself. You can have anxiety, you can have depression, you can have changes in your bowel habits, you can have dry skin. So just go check it in the winter. Say you've got dry skin and that you're tired, then they should be checking that. So checking your thyroid hormones is a big one. An iron panel is another one that's not routinely checked unless you come back with an anemia, but you can be iron deficient and not be so low that you have anemia yet. So
I did not know that.
Yep. So in iron too, also low iron can cause sleep disturbances, especially from something like restless leg syndrome. So checking an iron panel can be really, really important. And so again, things for fatigue, for sleeping, even shortness of breath, that's again going to be more with if it's caused an anemia, but those symptoms can be really helpful. Other things you may not think about, again, going back to sleep, would be a sleep study. So a lot of patients have undiagnosed sleep apnea. You do not need to be an overweight or an obese person to have sleep apnea. So if you are waking up several times at night, if you're feeling exhausted during the day, if you find yourself falling asleep really easily in certain situations, certainly if you have a larger neck circumference or overweight or older, so over 50, these are all risk factors for sleep apnea. Certainly if you're snoring. So usually we use the cutoff of, are you snoring loud enough to be heard through a closed door?
Oh.
And so if you're snoring loudly, you're like, oh no, I don't associate with those people. Those people don't sleep with me. So, and again, for your kiddos too. So again, going back to ADHD, and again, I'm sure you're very familiar. A lot of kids with behavioral issues, they're just not sleeping well.
Yes. That's one of the questions we have on our preliminary, interview with parent is how much do they sleep at night?
Yeah. So, and are they snoring? Are they having restless sleep? So a sleep study can be really important. If you're having palpitations, which again, hashtag another possible perimenopause symptom, but if you're having palpitations, if you're having any chest or what you think are heart-related symptoms, then it is very important to get those fully evaluated, to get an EKG, to see a cardiologist, possibly get an ultrasound of the heart or a stress test and make sure that your heart is doing okay. Women with heart issues are not as dramatic as the men. Really? It's true with most things in life. You're like, we've got shit to do and we don't have time to be dramatic about it. So women who are having heart attacks generally have more discrete symptoms that can range from anything from nausea to I just sort of feel funny to like heartburn. Whereas men are doing the whole like movie star, like clutching their chest and the neck and the left arm, and they're just going down. Like, we don't do that. Again, we are moms. We don't have time for this shit. Like we birth children. We know what pain is. And like we don't even want to burden anybody with our death or those. Like, leave me in the corner. I'll just die peacefully over here by myself. So if you're having any of that, if you're getting more, you mentioned like your exercise, if you're getting really short of breath, this isn't like, oh, I haven't exercised in 3 months and now I'm tired when I get on the treadmill. This is like, man, just like carrying around the like laundry basket around the house. I'm like getting really short of breath. Or again, you're getting dizzy when you're exercising. These are all really important things that need to be evaluated and can be checked out.
And I think all of these symptoms are really obvious as to how this impacts our children. And that's what I want to come back to is us moms, we really need to realize the impact of our health on our children because it impacts our emotional regulation, our anxiousness, obviously our longevity, to be around our children, and the mood shifts. That is going to directly impact our children if we keep putting ourselves last on the list. And I know I'm preaching to myself because it's something I've been really working on the last few years, that we need to understand that if we are not like seeking out professional help and trying to find the root of these shifts in our moods and our regulation, it's going to impact these children and how they view us and how they might not want to approach you because you're in a bad mood or you're going to snap off on them. And then if they're not approaching you, then you don't know what's going on at school. You don't know what's going on in their lives, and going to impact the relationship you have with your children. And so I think it's so great that we have you as an advocate and other medical professionals out there that are starting to advocate more for women's health. It hasn't been a priority in our society for so long. And I am hopeful that we're getting there. We're getting there. And as we're ending, I do want to ask, what is one small shift that you've seen make a big impact on women's energy and mood?
If you made me pick one, I would say physical activity. And especially in midlife, where you're seeing all over social media the big push for women to strength train and to not just be cardio queens and be exercising to be skinny, but to be strong. I mean, I just had a patient this past week who I only see once a year. I love her, but she's generally takes good care of herself. So I only see her once a year. And I asked her and I said, hey, how have you been last year? And she's I think she's in her late 50s, early 60s. Okay. And she said, well, I really took to heart what you told me last year. And I'm thinking like, oh no, what did I tell her? Like, okay, she came back, so let's not be too bad. And she said, you told me like I was getting really frustrated with like kind of weight gaining around my middle and just kind of feeling blah. And she's like, and you told me like I needed to move. And she said, and so I really listened and I started doing Orange Theory. And she said, I feel amazing. This is a 61-year-old woman doing Orange Theory 2 to 3 times a week. And she told me too, she said, you may have noticed that like my weight on the scale hasn't changed. This is not a petite woman, y'all. This is a big boned, tall Irish woman. She is very strong. And she's like, I feel like I got my strength back. She said, I've always been an athlete through my whole life. I don't know why I stopped. But she said, this gave me my confidence back. I feel like my energy, my joints aren't hurting, as much anymore. Yeah. And I will say too, as somebody who, again, we have a similar kind of body type, again, I think we're healthier than most people. But after I had all my babies, I felt like my muscle mass just dropped off a cliff.
Absolutely.
And I remember like laying my babies in the crib and I'm like, oh my God, this is late. Like I shouldn't feel this bad in my 30s.
Right.
And so that's when I made the jump. And I understand that this is an expensive one and that not everybody has access to this, but I made the jump and hired a trainer because I didn't know what to do.
Right.
I am not an athletic person. I've never lifted weights in my life. I only go 1 day a week for an hour. It's not something, and I have to go like during my lunch break in the middle of my work week because again, I have little kids and I have to go home and once I'm at home, it's all bets are off.
Yeah.
I go once a week and man, what a huge change to feel like, and even my trainer was like, oh, girl, your muscle's there. You just weren't using it. You just didn't know how to isolate it, how to do it. And I'm telling you, as soon as you start to feel strong and to move and have that sort of reminder each week, which again, now I just joke. I'm like, thank goodness I have this schedule on my schedule because I wouldn't do it at all. I mean, I'm so tired again from all my other responsibilities.
And it's an investment in your health. It's an investment into your children indirectly.
Exactly.
When we can take that time, that physical activity, and something that you enjoy.
Yes.
Doesn't have to be
it's
the
something
treadmill.
too that I wouldn't have even thought that I enjoyed. I mean, I just went to go, hey, I'm having some aches and pains. Can you help me kind of like get my butt back, like where it went? And now I really enjoy it. I will say too, as far as like impacts on kids, studies have shown that families that exercise together or that parents that exercise, their kids start to exercise. And it's just something you naturally do. Like you mentioned, like you went on a hike this morning. We do that with our kids. That's just part of their day-to-day activity. We're not all like running on a treadmill together, but and when I'm doing, some exercises and stuff at home, my kids are playing with my yoga blocks or doing other things. And it really does just continue to snowball for them.
Absolutely.
And they too, like you mentioned, us putting ourselves on the back burner. If you constantly do that, your kids see that too. And they're going to stop trusting their gut and their intuition.
Right.
And so they're going to go, well, she such not her, but she didn't do anything about it. So they're going to start just pushing through.
Right. Yeah. We're teaching our kids how to treat themselves.
Exactly.
If we put ourselves on the back burner, there's this show I've been watching. It's a Korean drama, but
nice.
When Life Gives You Tangerines, and the mom saw that because she kept putting herself on the back burner, as when her daughter got older, she did that to her. The daughter did that with herself. And so our children are really watching what we do, and they're going to mimic that as they grow older.
Yeah.
And like you said, it doesn't have to be very complicated. It can be going to the park and taking a stroll. It can be taking your bikes out.
Yep.
It can be, like you said, a lot of times I work out in my garage. My kids are playing around me or they're riding their bike around me. And it doesn't have to be complicated. But I love how you said that, because physical activity is something that we all have access to regardless of income level. You can make it happen.
Yeah.
Even if it's just once a week, even if it's just 15 minutes a day.
And even if it's not dedicated, exercise, like park at the back of your parking lot.
Yeah.
And walk in then. They just had a new study came out. I don't remember if it was the Lancet or New England Journal of Medicine talking about the 10,000 step, number. They're showing significant benefits at just 7,000 steps. Right. So turn that step tracker on. I just got, I'm really loving it on Prime Day or whatever this year. I just got a walking pad for my office.
Oh, yeah.
It slides under my couch in between phone calls or whatever. I'm just on there walking. I'm listening to my podcast. And that's how I can get my steps in, because I'm getting a piddly like 1,000, in my office. And so that's another thing. It doesn't have to be this whole big giant exercise plan. Just start by turning the step tracker on your phone. We all have them. Just see where you're kind of lazy at.
See what your baseline is. Yeah,
exactly.
Absolutely.
So I think that's a great, if you can work any type of physical activity in, it's always going to pay off. It's an investment in your future.
Absolutely.
And again, energy, it's going to help regulate all your hormones, including your insulin level, your blood pressure, all the things. If you had to pick one that's going to help it all, I would say exercise.
That's good to know.
Yep.
And it's so easily accessible to everyone.
Yep.
No excuses, ladies.
That's right.
All right. So we'll go ahead and end. Thank you so much for being on. So fun. Yeah.